order, so I would like to propose a motion to adopt the minutes of the Capital Committee meeting held on April 8th, 2024. All in favor, please say yes.
Yes.
Opposed, say no. So the motion is adopted. So next we will hear the Vice President's report, Mr. Saiz.
Thank you. Good morning, everyone. As the end of the fiscal year nears, we are working diligently to ensure that our fiscal year 2024 contracts are registered with the controller to ensure that we meet all of our commitment goals and have timely starts to our projects. We received approval to proceed with the next phase of OTXHU and are actively working with our CHS, DOC, and SCOC partners to move forward with procurement for all the work at NYC H&H Woodhall and NYC H&H NCB. At NYC H&H Elmhurst, we are currently in the procurement for the first phase of our larger emergency department renovation. We have opened up the staff wellness room as well as the radiation oncology suite, which includes the new LINAC and CT scanner. At NYC H&H Metropolitan, the new wellness room is complete, and we have been able and has been furnished. We have commenced to design the condensate riser, and the Ronald McDonald House sprinkler work has also started. At NYC H&H Jacoby, we have completed renovations for the IT department, which include 2 training rooms for staff. And for this month, we have 4 items: NYC H&H South Brooklyn maternal health renovation, system-wide life safety services, Gotham Williamsburg clinic lease, and the Bellevue sleep disorder clinic lease. And that concludes my report. That'll take any questions.
Hi. Thank you. Any questions?
I just have a quick question. What's the status of Bellevue?
For the OTXHU project. So we're wrapping towards the end of that project. There are some services that we're starting to work out with EVS and Linen Services. And I think right now we just have to finish up the expansion of the parking lot area, which leads from the, it's easier to show you on a map here, but
Yeah.
where the triage ambulance bay is, that needs to be worked out. There's some other flood protections that we're working out there, but the project has been coming along pretty steady. Eddie, Oscar, you have anything to add there? Did I miss anything?
No, it's just wrapping up the elevator, the canopy, the generator is getting implemented as well as and all the tie-ins. So a lot of the infrastructure is still wrapping up, and we're still tracking towards the end of the calendar year to be able to provide services.
Terrific. Thank
You
you.
reminded us about the generator, because I remember that was an issue because of the size. So in the end, what solution did you go with?
We ended up going with the larger generator.
It's arrived. I remember at one time you were concerned about the shipping times.
So we're still a little bit concerned, and we do have a backup plan. So in the event that it does not come in November, we did incorporate all the tie-in connections. That way we can bring a temporary generator in place, tie it in, and then we can provide services. And then whenever the generator does come, December, January, February, then we can just simply swap it out.
Interesting, the things we remember, right?
And the things we never forget.
Any other questions or comments?
No, thank you.
Thank you so much, Manny. So let's go through the resolutions. Lyra?
Okay, great. Hello, we're here to request approval authorizing New York City Health and Hospitals Corporation to sign a 5-year lease with David Wellner, doing business as Wellner Associates, for the use of the entire building at 279-281 Graham Avenue in Brooklyn, New York, consisting of 10,900 square feet. The building, together with 1,185 square feet of vacant land adjacent to the building, for use by New York City Health and Hospitals Gotham Health for a primary care clinic at an initial rent of $57.83 per square foot, which will increase by 3.5% annually to reach $66.36 per square foot by the 5th year, provided that the system will hold 3 options, each for 5 years at a rent based upon a continuation of the pattern of 3.5% annual increases for a total rent payable over the potential 20-year term of $17.83 million. I'm going to turn the tables over to Dr. Tadlon, who's going to talk about the clinic and how it's used, and then we'll quickly go over the lease. Deborah Morris and I, the Senior Director of Real Estate.
All right. Thank you, Lior, and thank you for giving us a few minutes of your time today. So what I want to do today is go over Gotham Health in general and its footprint in Brooklyn, drill down into this clinic itself and some of the history behind the clinic, and then drill down into the data, which shows us the impact the clinic has had and the continued needs in the community. So here on this first slide here, you can see that Gotham Health currently operates 30 locations citywide, including 11 in Brooklyn, and you can see circled here where this clinic is, covering that catchment area, if you will, of Brooklyn. So I'll go to the next slide. This clinic here has had a rich history with us. One of the interesting facts is it's the first community-based clinic in Williamsburg. It provides today and has proudly provided for many years women's health services, adult primary care, pediatrics, nutrition services, among others. It again is the first clinic first community-based clinic in Williamsburg. It opened May 20th, 1994, 30 years ago now. And previously was a Woodhull site and converted to be a Gotham FQHC site in 2017. It's located 2 blocks from the Grand Street L station and occupies approximately 11,000 square feet across 2 floors. Next slide, please. In terms of the demographics and the patients that it serves, we completed about 8,700 visits in 2023. That was across about 2,400 unique patients. Among patients that disclosed to us their race, the predominant race disclosed was Black or African American, and that is the orange part of the slide here. Next slide, please. In terms of the community health profile, I want to list out some of the community health, and this is from data from the Department of Health, some of the community health outcomes for this community in particular, and then cross-reference that to the rest of New York City to show that this clinic has had a positive impact on the community over time. Just to draw a point of distinction, when we came, for example, to the board last month about a new clinic in downtown Far Rockaway, we presented data showing the community need that a new clinic would be able to solve. Here we're showing some of the continued need, but I also want to make the point that we're showing some of the outcomes that this clinic has contributed to achieving for this community. For example, for childhood obesity, 1 out of every 5 children in the Greenpoint and Williamsburg area, in terms of children, have obesity. That's compared to about a similar rate for the rest of New York City and the rest of Brooklyn. So the clinic has contributed to being able to not have that rate go higher than the rest of New York City, and has, I think, been an important part of the pediatric services provided. 2 in 5 people, adults in Williamsburg, have reported getting a flu vaccine in the past 12 months. Per the Department of Health, that is similar to the rest of New York City. But then we see a few areas where the clinic has excelled. So 10% of adults without insurance went without needed medical care in this community. That's lower than 13% in the rest of New York City. So about a third lower in terms of this area compared to the rest of New York City. In terms of avoidable hospitalizations, you see the impact of the clinic there too. In terms of the Williamsburg area, there was 1,041 avoidable hospitalizations in 2019. That's to be compared to 1,213 in the rest of New York City. So significantly lower in this community than the rest of New York City. So these are a few ways between ranging from adults going without medical care at a lower rate to avoidable hospitalizations being at a lower rate too, that shows some of the impact that this clinic has helped to contribute to over the last 30 years in this community. In terms of ongoing needs, drawing from the second part of the slide here, our 2022 Community Health Needs Assessment shows that there are ongoing needs that are consistent with this as well. So residents in this part of Brooklyn, or in Brooklyn, express the need for continued culturally and linguistically appropriate care in this community, Many residents noted that they were going to the ED or urgent care, especially if they were uninsured or unable to get healthcare coverage, which this clinic, of course, provides. And the community identified certain chronic diseases such as diabetes, high blood pressure, and mental health issues as some of their top health concerns. And this community and Brooklyn also found that heart cancer and heart disease were the leading cause of premature death, which of course are related to the chronic diseases that people explained were some of their key concerns, which this clinic addresses every day and did for approximately nearly 8,000 visits last year. So going to the next slide here, in terms of the lease terms, did you guys want to go over this or do you want me to?
No, we could do it.
Okay.
Um,
We were always going to go over it.
We're gonna go over it. We've been at the building for 30 years. We discussed the size of the building, and as we said earlier, it'll be a 5-year lease with 3 5-year options. We've done a fair market analysis. The new rent will commence at $57.83 a square foot, so that's 3.5% above what we're currently paying, and we continue on that trend. Gotham is responsible for operating expenses, including the water, electricity, and the maintenance. Property taxes will be waived by the Department of Finance, and if we decide to stay in the space for 20 years, it'd be a cost of almost $18 million, but right now we're committed to 5-year increments. So, open to any questions?
I have questions for you, Leora, and for Ted. Ted, turning to you,
Yes.
looking at your demographic profile, you've got about 2,300 unique patients, and yet 62 of them don't disclose their kind of demographic data. But you see people going in and out of the clinic. Is it your sense that it is primarily, say, a larger percentage of blacks who are not disclosing? It's just an unusual figure for 62% of people not to disclose.
Yeah, it's so the way this data is collected, this is the same approach we have system wide. It is true across all of our clinics. We don't require you to disclose your race in order to receive care. So this isn't very different from a lot of our other clinics. But to your question about sort of what anecdotes do we know about the people coming to our clinics now, actually, Romo was just sharing with me. Do you want to share about what we're seeing in terms of Hispanic patients?
Yeah, so just like Dr. Long said, speaking with the clinic, there's been a uptick in the Spanish Latin community coming to this clinic. Can't speak if they're the ones not disclosing specifically, but we have seen that trend.
Okay. And would you say that the demographic data for Greenpoint and Williamsburg are similar, or is there a significant difference? Do you know?
I don't know about the specific differences between those two communities, but what I do know is that the Department of Health, how they look at the data, they do collapse those into one community profile. So that's where the statistics that I gave you, for example, comparing adults without medical care, and it was lower in the community this clinic serves than the rest of New York City, and avoidable hospitalizations were lower in this community compared to the rest of New York City.
Right.
DOHMH does collapse the data a little bit between those communities in order to come to those conclusions.
I think Greenpoint has historically had a big Polish patient population.
Okay.
So there's Polish is spoken in the clinic, and Greenpoint has changed a lot.
Right.
But it's been a Polish area for a long time. Polish and
interesting.
Eastern European.
And Leora, about your, without getting into a lot of the detail about the lease terms, and I know we've got an appraisal, but it seems like there was a little bit of tension. I mean, that we're being pushed a little bit on the 3.5% annual increases, on the landlord work that's being required. I think it just feels like between we've been there 30 years, we'd like to continue to stay there. We have an existing relationship with the landlord, so it wasn't, you weren't starting from scratch in negotiating the lease. But looking at the rental terms, it just seemed that we were on the outer ends of the higher ends of the spectrum.
I think everything you said is true, Sal. I would say that our current lease has a 3.5% increase annually,
Right.
so we continued on those terms. We want to be in the space. It is a hot market. There aren't many options. The space is built out. It's operational. We're not starting from scratch, and so we continued on those terms. But Deborah and Jeremy negotiated hard with the landlord to do certain piece of the work that needed to be addressed, and so I think generally we're satisfied. We're doing also, it is a little bit outside of the norm to do 5-year lease terms, right?
Right.
With 5-year options. So if you
Right.
go longer, there's a commitment
Pay
and you
more.
have more leverage. So,
Yeah.
but generally we're satisfied with where we landed.
And, I had another question about the lease. Oh, the capital improvements that the landlord's gonna do. Do you have a sense of the value of that work that he's gonna do?
Sure. So I'm Deborah Morrison,
Hi.
Senior Director for Real Estate. So the landlord has already repaired the roof and has commenced work on repairing and re-insulating the ductwork. That ductwork, we estimated the cost of that to be several $100,000. We suspect him doing the work on his own is lower than that, but he is undertaking that work at no cost to us. He's already replaced the basement stairs, which were unsafe, as well as some coping on the facade. So he is undertaking significant amount of work to improve the functionality of the space, as well as agreed to replace, if requested, to replace the actual HVAC systems as needed at cost, which could be quite a savings for us compared to us embarking on that work.
Okay, thank you very much.
Sorry, Deborah, could I just follow up on that? So the work you're speaking of that he's doing, he's paying for, or?
Yes, he is paying for that work.
But if
But
there's additional-
replacement, so there are 5 HVAC units. They're at different ages. Some are quite deteriorated due to deferred maintenance. Others are quite new. And he has agreed to replace them at cost at our request. And we would pay as additional rent over the remainder of the term when that replacement is necessary. So we can replace them one at a time as they go out.
So it's a relationship that we have with landlords in a lot of different places where we're responsible for maintenance and they're responsible for replacement. So, you know, those two things bleed into each other. You can probably almost always keep a piece of equipment going, but at what cost, and, you know, loss of efficiency and so forth. So, so what we've worked out is that the maintenance is our responsibility. There's a whole package of maintenance that is going to get done, which has been deferred, and we kind of queued him up to be ready to replace unit by unit as they age out and become no longer practical to repair.
And what was the prior lease term? Was it 5 years with,
It was a 20-year lease with a 5-year option.
so same as we're doing this time?
No,
No.
this time we're doing 5 years
That's 3,
with
5.
3 5-year options.
Oh, last time it was 20-year with a
20 years.
5-year option.
So it was a much bigger commitment. So this time, you know, given how much the market has continued to increase in this area, I think there's some caution on Gotham's part to make a long-term commitment to this location, because just the cost of being there is constantly increasing at a rate which, you know, you see it's not like what any of our other leases have.
Right. So what would the option, let's say we come 5 years later, is the option to locate out of Williamsburg or to find other space?
Well, I don't think we have a plan for that, so it's reserving by chopping it up in that way, we're reserving the possibility to reconsider at 5 years. And one of the things that we might reconsider is trying to negotiate with the landlord to reduce the rate of increase.
Mhm.
I mean, that's not to say he'll do it.
Right.
You know, we at least have a swing at it.
Yeah.
Or, you know, consider relocating. And, you know, relocating is a very big deal.
Yes.
To find the space, to build it out,
Right.
to organize the money and so forth. So it takes a lot to plan for that.
Have you explored purchasing it from him?
You know, we don't normally purchase property. I mean, to be honest, we've never purchased any property. And so the property that we own, the couple of properties we did purchase, but they were out of a bankruptcy, was, you know, kind of the whole thing was negotiated. So it's not our pattern, and it's not the pattern for the city to give us the capital to do that.
I just have one other
I think,
question.
well, we can talk about this, I mean, not for this particular case, but we should, it's
Isn't-
something to, we talked about it briefly on this building, but
Yeah, we talked about it at some other property. I forget which one it was.
this one, I think,
Oh, was it this
Yeah.
one? Oh,
because it's condoed already, so you could purchase the pieces.
Oh.
It's something to think about, if we wanted to stay in that location.
Sounds like we want to.
Sally.
I had a question for Mitch, but he walked out. It's just, it's the case that this is not self-sustaining,
Yeah.
right? That's the case with the clinics generally.
yeah.
Okay.
And I,
Okay, thanks.
so sometimes I was walking down the street the other day and I see a, you know, a furniture store that moved from one side of the street to the other side of the street. And I wonder, like, why, you know? And with a 5-year term, you know, I think that gives us enough time to think about different options.
I think we pretty much satisfied ourselves that there's nothing else that's a good option right in the immediate area. So it would be, I think that's the hesitation about leaving that clinic, because it would leave that area unserved. So, you know, could
But I think
we?
to your point, Jose, as Jeremy's saying, there's no other great option right now. So, you know, the part of the logic of this is that we'll have time to continue to assess need and see what the opportunities will be going forward.
And just, I think, Leora, you mentioned this, the old lease also had 3.5% increases annually, right? So we're not, it's no different than where we were.
Correct, where he likes us as a tenant and,
Right.
you know, he didn't offer to sell us the building. He didn't go, oh, you know, why don't you buy it for 17 million? I think it's a family business, and, you know, we pay the rent on time. So I think it's hopefully mutually beneficial, but we could decide as this clock runs through what we want to do. And as Jeremy said, if the 5-year mark comes and we're committed to staying, then we could potentially renegotiate the other 15 years in a way that is more beneficial to the system.
Okay, Sally, your vote is not contingent upon the question, right? Or is it?
No, no, no.
Okay, so let's, I would like to take this to a vote. All in favor, please say yes.
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 Opposed, say no. So resolution approved. Thank you so much.
Thank you very much.
So let's move to the next one.
Deborah's going to read the next resolution in and discuss the sleep disorders clinic at Bellevue. Unfortunately, Bellevue leadership had some conflict today. If there are clinical questions related to the presentation, we'll bring it back, and they'll be present for the board meeting.
Good morning. This is a request for approval authorizing the New York City Health and Hospitals Corporation, the system, to sign a 5-year renewal of a revocable license agreement with the Sleep Disorders Institute, SDI, for its use of approximately 1,038 square feet to operate a sleep disorder clinic on the 7th floor of the H building at New York City Health and Hospitals Bellevue, the facility, at an annual occupancy fee of $68,954 or $66.43 per square foot, to escalate at 2.75% each year for a 5-year term, total of $429,347. Next slide. So the Sleep Disorder Institute is a full-service center specializing in the evaluation of treatment of disorders of sleep and wakefulness. SDI is accredited by the American Academy of Sleep Medicine and has been operating at New York City Health and Hospitals Bellevue campus since June 2019, including throughout the COVID-19 public health emergency. SDI has 5 sleep study beds, as well as hundreds of devices to offer at-home sleep studies with no wait. For the current patient referral agreement with H&H, SDI provides inpatient and outpatient services to patients referred by primary care physicians, cardiologists, or other specialists at Bellevue. This includes patients without insurance and patients under the custody of Department of Corrections. Sleep disorder employees can schedule patients for sleep studies on Bellevue's campus or at home. Across the last 5 years, the Sleep Disorder Institute has served a significant number of patients, starting at 158 and now presently 413 as self-pay, 730 in 2023 billed to patients' insurance, and in total in 2023 conducted 1,143 sleep studies. Just to go over the license terms, next slide. The Sleep Disorder Institute will occupy 1,038 square feet on the 7th floor of the H building of New York City Health and Hospitals at 462 First Avenue, New York 10016. It will be a 5-year license term, which will commence upon execution of the license. The base rent is a fair market value of $66.43 per square foot to escalate at 2.75% each year for 5 years. And the total annual occupancy fee for base rent over the potential 5-year term will be approximately $429,347. Please let me know if you have any questions.
I just had a comment.
And so, resolution for approval authorizing New York City Health and Hospitals Corporation to sign a 5-year revocable license agreement with Sleep Disorders Institute.
Just a comment. I actually used this sleep clinic and went to their other facility on 55th Street. And there was a marked difference I found in what I'd say the comfort level of being at 55th Street versus being at Bellevue. But I spoke to Bill and they made improvements, and so I think it's a fine little facility now.
I just had one question. For the patients, do we have priority at Bellevue patients, or is it?
Yes. So the majority of patients do come from Bellevue,
Okay.
although outside patients are allowed to use the facility.
On the note of on Sally's comments, is there a way of asking them when you negotiate on this that the facilities are the same in any way, or that the quality provided is similar, or?
I'm happy to bring that back to the facility, and we can bring it up with SDI about making improvements to the facility to match their other facilities.
Yeah. Okay. Any other questions or comments? Okay. Let's take it up for a vote. All in favor, please say yes.
Yes.
Opposed, say no. Resolution approved. Thank you so much.
Thank you.
Next one, Mike.
Okay. Good morning once again. This is authorizing New York City Health and Hospitals Corporation to execute a design-build contract with Access Construction Corporation to undertake a development and integrated women's health suite at New York City Health and Hospitals South Brooklyn Health for a contract amount of $22,995,627 with a 10% contingency of $2,299,563 to bring the total not to exceed $25,295,190. And with that, I'd like to hand it over to Kelly Burns, who is our Director for Design and Construction at South Brooklyn Health.
Good morning. Currently at South Brooklyn Health, the Women Health Services have seen a 35% increase in births, from 900 births in fiscal year 21 to 1,400 in fiscal year 23. Additional modifications and upgrades are in order to improve clinical operations and patient experience. The current Women's Health Program services are approximately 11,000 square feet and are located in both the tower and the main buildings. South Brooklyn Health currently has 20 exam rooms, 3 of which are used as treatment rooms, and 4 ultrasound rooms located over 2 floors. Next slide. Future state. South Brooklyn Health will feature an integrated women's health suite that will be focused on the patient and family experience. The space will be adjacent to the current inpatient postpartum unit, which will improve the continuity of care during and following a patient's labour and delivery. The space will improve access to high-quality patient-centred care through changing the model of the care. The new Women's Health Suite will include approximately 20,000 square foot of integrated services on the same floor, approximately 28 exam rooms, six ultrasound rooms, 6 multi-purpose procedure rooms, as well as staff support, education, and waiting areas. The multi-purpose procedure rooms are designed to support patient experience and allow clinicians to meet the patients in one room for their appointment. There will be a reception area, waiting triage, and 3 observation bays included in the north side of the 8th floor. The family comfort space and amenities to support the mothers, partners, and families during appointments. There will be education spaces and additional waiting space to meet the needs of the community and the patients' families. This is a layout of the proposed future state. The bottom of the screen is the outpatient areas with the exam rooms and treatment rooms located around the perimeter of the space, and the north side is the triage, waiting area, and the observation bays. Any questions?
I'll be quick, I promise. Maybe you could help me understand better the purposes of the different rooms, because they're not labor, are they labor and delivery rooms?
No, this is going to be an
confused.
outpatient women's integrated services, and it's going to follow through the care before, during, and after labor and delivery.
I see. So it's not inpatient, it's outpatients who come for the services from pre-delivery till
Right
post.
through to postpartum, yes.
Okay, that was confusing. And you had one point about for community use, which just wasn't clear. Space will meet the needs of the community. You didn't mean the community using the rooms, you just mean the community at large?
Community services, the education spaces are designed to bring some education to future parents and their families. And there's also additional waiting areas that will include the community's needs with a kids section to the side, stroller sections, and other areas.
Thank you.
That growth in the number of births from at 35% from 900 to 1400 is it's pretty impressive. So I was just wondering whether the space that this, I suppose you're expecting it to flatten out now or stay around that, and is this going to be able to provide to meet those needs?
This will meet the needs. We are adding additional exam rooms, and the treatment and multi-purpose rooms will be separate instead of having to use the exam rooms for treatment. The multi-purpose procedure rooms, the clinicians can all meet in the one room rather than the patient have to change and go to different areas. So
So it's flexible enough to meet
Yeah.
the 1400 or any small growth.
Right,
that
I
happens
mean,
after that?
nobody really understands exactly what's fueling the growth.
I was going to ask you that.
I know.
The two things, yes, at base we know. The two things that we know are true, asylum seekers are healthy, they're not using our hospital, but they're having a lot of babies. Right, so, and Floyd Bennett Field, which is one of the places, is right near, they use South Brooklyn Health. So that's one thing. And then there's also probably a certain number of people who put it off during COVID. Right, put off getting married, put off dating, put off.
So it's not because other
procreating.
facilities are
It could also
closing
be
or
that,
not
you
closing?
know, that the new facility, but probably not. I mean, there are a number of other facilities in Brooklyn, right, including NYU and Presby. I think it's most likely the first two. But we'll find out.
Thank you. Okay, so any other questions or comments?
Were they going, no, I don't think they're done.
Yeah, so I can talk about the procurement.
I'm sorry.
Oh, sorry.
Just add a little bit of color. Everything you just saw was just essentially conceptualized, but in order to, expedite on the program, we decided to do this through the design build model, where, we're just creating the concept right now, bring on the design builder, and be able to do early packages, finalize the designs, finalize the construction, and then hopefully save some time and save some money at the end of the day. So the state requires that we have a two-step process, RFQ and RFP, request for qualifications, request for proposal. So as a minimum criteria, we asked all the vendors to have design build experience with at least 5 projects that are worth over $10 million and have healthcare and clinical project experience. They have to have experience working with the city, and they have to have an MWB utilization plan. So as mentioned, two-step process. The first one is the RFQ, where the majority of the scoring goes into the firm's experience. So they are, so we validate through that process, go through the scoring criteria, and then at the same time, we're finalizing our design criteria or our bridging documents in order to be able to put that together with the RFP. Where at that point, we shortlist a group of vendors, and we, mainly score on the approach methodology of the project itself, and also on the staff experience, because design build is really about collaboration and flexibility. So those are the two-step selection process, and then you see the list of the evaluation committee members, which is a balance of OFD members, South Brooklyn members, and central office, finance, and the ITS. So a quick overview on the procurement. In December, the RFQ was released to City Record and also sent to 12 vendors directly that we know have design build experience. In January, we had a pre-proposal conference where 47 vendors attended that conference. Out of that, we received 10 statements of qualifications. And in February, we received the final scores, yielding the top 3 vendors being Access, EW, and Sinalta. We released the RFP to those 3 vendors, and then we conducted walkthroughs, and we received proposals by the end of February. In March, we vendor presentations, and then we did the final scores where Access came out as the highest rated proposer. And the next slide shows the just a quick overview on the contract. So the contract will be for nearly 23 million. It's expected to begin this summer, and we're doing a three-year term with two one-year renewal options. But we're expecting the project to take less than 2 years. But then we'll have to go through the regulatory approvals and the closeouts and et cetera. Access has had previous work with New York Health and Hospitals. They built out our Coney Island Ida G replacement clinic and also our Vanderbilt clinic. One got a satisfactory and the other one got an excellent. As mentioned, the work is expected to begin this summer, 2024, and they have produced a MWB utilization plan of 32%. And there you see the list of their sub-consultants and contractors that they will be using for the work. Next slide is the performance evaluation questionnaire, where we obtained a rating of good. And then the project budget of design build of 23 million with a 10% contingency of 2.3 million to total 25.3. The CP is currently pending OMB approval, but we are still in the negotiation process with the vendor, refining the scope, refining the schedule, refining the risk, and hopefully we can either reduce the price or really reduce the expected solution that they're going to produce for us. And the last slide is I think that's it. Oh, yeah. And there's the request.
Thanks, Oscar. So I know we've been using design build now a lot more, which seems to be working well for the.
It's still being implemented slowly.
Yeah.
Yes. This is our second or third clinical project that we brought to you. We have a few more in the pipeline. Our first self-managed design build project, which is Harlem Boilers, is an infrastructure project that's going really well, and I'm hoping that we can carry on that success through the clinical program
And
as well.
generally, how do you decide why to use design build versus?
There's multiple reasons. One is a state mandated reason, so the project has to be over $10 million.
Okay. But if it's over 10, you don't have to use design build.
We don't have to. We don't have
But
to.
you're eligible to.
Yeah, as I mentioned, collaboration, flexibility is really the key. We have to have all the proper stakeholders at the table. We need to be able to make quick decisions. So if we see that there's either too many complexities, too many challenges on the job, we may want to move away from design build and go with more of a traditional model. But here, we felt that it would be successful, with all the doctors and nurses, the leadership at South Brooklyn, to be able to all come to the table, make quick decisions, and release those early packages and get the project moving forward.
So the process is you guys come up with the general scope of what you want. You go out to bid with that.
Yeah, it's basically a vision. We have a vision of building out 20,000 square feet of space. We know it's clinical. They know the vendors know it's clinical, so they have an idea of what they have to do. But things could change along the way. But at the end of the day, there's still a finite footprint. If we were to go out and say, we want 20,000, but then we make it 40 or 50,000 square feet, okay, that's going to obviously lead to problems. We'll have to come back to the board. We'll have to get additional approval. So it won't make the project successful. But if we have a sort of a clear vision of what that scope and schedule should look like, they can put a number to it.
But the difference is this a guarantee? It's not a GMP.
This is not a GMP, no.
And so the 22.9 right now is
22.9 is a number that incorporates all of their design, their construction. They do have some contingency within that number as well, because there's still a lot of unknowns. We haven't designed for plumbing. We haven't designed for electrical. We haven't designed for, there's a lot of components that are not included in there yet, so there's still a lot that has to be specified. And when it does, they're assuming the worst case scenario, so that's why the $23 million is there. So that's why Kelly and team continue to talk to them to kind of refine that information so that way we can kind of really narrow down.
So from our perspective, this is a not to exceed. You
This is more of a
anticipate
not to
get,
exceed, yes.
And you've built in another 10% contingency on.
So that's more of an owner's contingency. So I want to say that the contingency that they have within the 22 million is more of a field conditions. You know, if you know they didn't, you know, we anticipated asbestos, but maybe there was a lot more asbestos. You know, so things that we can't really quantify. The owner's contingency is more for if we decide to add scope.
I see.
So if we want additional rooms, if we want additional equipment, if we want, instead of 20,000 square feet of space, we want 25, maybe we can, you know, pull that out of there. So there is some extra budget. If we don't have any additional scope, then that money stays with us.
Okay, great. And the term, I think you said it's a 3-year contract, 2 1
It's a
year
3
option?
to 1 year option.
But you expect to be done in 2?
We're expecting to be done in less than 2. That's our goal. That's what we put out to the vendor, and that's what we're going to aim. We're, you know, the monies came from Borough President Reynoso, so he's very excited to see these things open up. So we're trying to push as hard as we can. But even when we do finish the space, it's a matter of getting a temporary certificate of occupancy, getting the state to approve, closing out all the documents. If there's additional challenges or additional issues, at least we have that flexibility within the contract terms. But it should not take us to 5 years.
Great. So, but just the difference in design build is you don't kind of have a guaranteed price and delivery time.
Correct. It's not. It's
But
not.
you're in a
Yeah, because
collaborative-
once you put a GMP on there, then they really put on a lot of risk. So that 22 million would be more like 30,
Right.
just in case.
Yeah.
And they stay with that money as well. So
Okay. Great, thank you.
I just have a quick question about the work that you're doing. Is it relocating part of the existing uses? I got a little bit confused. It's not all,
The current women's health services are located in the tower building and the main building. So there are 2 separate buildings. There's a
Right.
lot of area to walk to get from one to the other. This will allow everything to be on the one floor, on the east and west side of the 8th floor.
right, but the existing uses now, because you're using the room, that geographic space now, right?
This space at the minute, the west side is actually empty because that area moved over to the RBG building, so we kept that closed knowing this was coming up. And the east side is on-call rooms and offices that we have already set up in other parts of the hospital.
Oh, terrific.
So we're not
Okay,
losing any services while we do the construction.
that's great. Thank you.
Great, thank you. So let me take it up for a vote. All in favor, please say yes.
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 Opposed, say no.
thank you.
Motion approved. Thank you so much.
Okay. Good morning once again. This is a request for authorizing New York City Health and Hospitals Corporation to execute a contract with Jensen and Hughes Engineering, PC, to provide life safety services to all of our acute hospitals for a contract amount of $7,348,135 with a 10% contingency of $734,813.50 to bring the total cost not to exceed $8,082,949. Next slide. A little bit on the background, the system has an existing contract with Jensen and Hughes, who provides all of our life safety consulting services for all of our acute facilities. Some of the scope, and not limited to, but this is the basic scope, is life safety assessments, barrier drawings, comprehensive accreditation, infrastructure assessment, sprinkler, exit signs, etc., and physical environment document review, a full document review as if we were in joint commission mode when they're doing their mock surveys. The current contract with Jensen and Hughes is a 5-year term. It began in February of 2020 and expires in February of 2025. The contract fee is based on annual surveys for each of the facilities at a fixed fee of $1,224,600 per year. RFP was issued for a new contract, and to ensure that we are getting the most competitive price in the market, we decided to test it out, and they have come up as the #1 service provider that we would like to involve with. And with that, I'll hand it over to Menji and there.
Good morning. So for the RFP criteria, minimum criteria is 5 years performing life safety services in the multi-hospital system within New York State and a presence in New York City. Our substantive criteria is our standard, and our evaluation committee was made up of a number of director of engineering from our various acute care sites, along with our finance and EITS colleagues. Next slide. quick overview of the procurement. Back in December of '23, the RFP was posted on City Record and sent directly to 6 vendors. We had a pre-proposal conference, 3 vendors attended. Proposals were due in February of '24. 2 proposals were received, and Jensen Hughes was the lowest, or the highest rated, proposer. Next slide. This is the vendor performance slide. Currently, Jensen Hughes is the vendor providing these services to the system, and they have received a rating of excellent. Next slide. The budget, so the base contract is approximately $7.3 million with a 10% contingency for additional services related to either adding additional square footage or requesting additional services from Jensen Hughes for a total not to exceed of approximately $8 million. Next slide. The vendor diversity. So Jensen Hughes will be contracting with JS Consulting Engineers and PLLC for annual door inspections and physical environment consulting to meet their utilization goal of 30%. As the incumbent vendor, Jensen Hughes currently has achieved a 27% MWB utilization plan against their current goal, with 10 months remaining on the current contract. So they have 10 months to satisfy the remaining 3% of their current utilization plan. And next slide is the request. Happy to take any questions.
Thank you. Any questions on this?
Just very quickly, I got confused on the money a little bit. You're going to finish off the contract at the end of February, and then you'll have a 5-year contract. It was $6 million under the old contract, but $8 million now?
Correct.
You went in hoping to save a little money?
Well, we did. So there are a number of things. We've added square footages. We've opened new sites. We've opened the RBG building, so that results in increased costs. Also, 5 years ago compared to 5 years now, prices have gone up a little bit. So as much as we tried to negotiate and achieve some savings, we had to deal with the market realities.
Still very competitive.
Yeah.
Okay, thank you.
Why did we go out so early?
Just in anticipation of our entire procurement process, we wanted to make sure there was no lapse in service. So, the contract will be queued up and ready and executed for January or February 1st, whenever this contract expires.
And also our joint
Wish
commission.
we would
This
give
is
that
as
question
early.
more often.
Right? Yeah.
That's not our usual question of
Usually
why
it's
did
like
we
we
go
have
out
to-
so early.
And also our joint commission schedule is pretty strict, and now there's clearly unannounced surveys, and there's no windows, there's no blackout dates or anything, so we wanted to be fully prepared to have no gaps.
Yeah. And this one is also 5 years.
Correct.
Okay.
Yes.
I don't think it says that anywhere, so, does it?
5 years slated to commence March 2025.
The last slide.
Okay, maybe in the.
In the
I thought
resolution, I think, right?
sometime.
Yeah, probably.
Yeah, we came out. Great.
So let me take this up for a vote. All in favor, please say yes.
Yes.
Opposed, say no. So resolution approved.
Thank you very
so
much. Have a great day.
Is there any
This
old?
just gets paid from our H&H budget, right?
Yes,
Yes.
it gets paid from H&H operating
Right,
expense.
okay.
Yes.
Is there any old business or new business?